I welcome Dr. MVS Satyaprakash sir, who is a professor.
Anesthesia drugs are the double-edged swords, though they help to reduce the pain and to run the smooth surgery, but associated with their own disadvantages. And this session is about the disadvantages and the common mistakes while using the anesthesia drugs. Now I'll request Dr. Elil Rajan sir come on the dais to chair this session. He is Professor and HOD of Department of Anesthesiology from Arapodi Vidu Medical College and Hospital, Puducherry, and he is a member in the professional bodies and the achievements and conducted many CMEs workshops in AVMCH, and he is a President Indian Society of Anesthesiology, Pondicherry branch, and he has done publications 4 international and 3 national publications, and his areas of interest is obstetric anesthesia and pediatric anesthesia. Now I request Dr. Champa Bhivi ma'am come on the dais to chair this session. She has done her MBBS in JJM Medical College, Davangere, and she is organizing co-secretary SZISACON 2021, and special interest is in regional anesthesia, rebel analgesia, and high-risk obstetric care focus. Request Dr. Krishna HM sir to come on the dais to speak on the topic of the effect of drug errors in the anesthesia.
Respected chairpersons, senior anesthesiologists, and my dear friends. Why are we here to know about the effect of anesthetic agents, that too the general anesthetics and the sedative drugs, on developing brain specifically? Because we will come across more often, more frequently, the questions from the Google savvy parents who are very anxious about their children undergoing the surgery. They have done more literature review than any of us, and they'll come with whole lot of literature and ask the question, does my child become less intelligent after the anesthesia that you give? They already have the competitive exams of the future, the JEE, NEET, and all those things in their mind, and they are troubled by that. They wouldn't mind even if the child has little pain. No, that becomes a secondary concern. A little vomiting, that's fine. But it's the intelligence of the child, it's the behavior of the child which is at stake now. So what do we answer? Do we have an answer? This is not a recent question. This question has been there to all of us for the last 3 decades. And this question has been considered so important that it's considered as top 10 research priority in the field of perioperative medicine. So anybody who is doing a trial study on this is very well funded, because we are seeking a definitive answer. Even by the reports from the animal studies which happened in the rodents like mice, primates like monkeys, it was so alarming that the FDA gave its recommendation in 2007 that all non-vital procedures under general anesthesia must be postponed till after age of 3 years, literally snatching away the bread and butter livelihood of pediatric surgeons. With more evidence coming in, the FDA reworded its recommendation in 2016 that repeated or lengthy surgery, lengthy use of general anesthetics and sedation drugs during surgeries or procedures in children younger than 3-year-old or in pregnant women during their 3rd trimester. Notice this change. They've added the pregnant women in the 3rd trimester also in their revised recommendation, may affect the development of children's brains. So there is an alarm, there is a caution, this is for sure, and there is something. What happens in the developing brain? Why are we concerned? When you see so many theories that have been put forward to explain something, one thing is very clear, that we don't know what is causing it. That's why there are so many things that are postulated. They say that the cytoskeleton of the neurons in the brain is affected. So you see some cell changes when you notice under the microscope. There are some changes in the neurohormones. So there are some biochemical changes which can be measured, which can be appreciated. The synaptogenesis is modified. The excitation and inhibition, the balance which is there in the brain during the phase of growth is altered. The apoptosis, some of the neurons, they just are programmed to die, whereas the others are continued to linger. This goes haywire. And all these, as a summation, could result in a change or affecting the intelligence, the neurocognitive, and the behavioral aspects of the children. Why is it that the developing brain is affected? Nobody is concerned about a 45-year-old getting an anesthesia, 50-year-old getting anesthesia. Is it because that they have already done with all the competitive exams? Nobody is bothered about their intelligence. It's only the children about whose intelligence we are concerned. The reason why the whole attention is about the developing brain and not the adult brain is that the neurotransmitters which are considered to be inhibitory in adult brain, like the GABA, or you have the several of the serotonin inhibitors, these inhibitory neurotransmitters actually act as excitatory in the developing brain. So we know that the general anesthetic in general is an inhibitory process. It suppresses the things which are activated in the brain, and when these neurotransmitters are inhibited by the general anesthetics, remember these inhibitory neurotransmitters are actually acting as excitatory amino acids in the developing brain, and hence the development of brain is affected. We all know that the blood-brain barrier in the developing brain, in the neonates, prematures, they are all more permeable. Hence, access to the amino acids is much more, and hence we could have the deleterious effects. In general, the volatile anesthetic, inhalational anesthetic agents are considered to be protective to the brain in the adult, but the same is not true with regards to the developing brain. There is a period of intense growth in the brain in every organism, and that period of intense growth of brain is called as brain growth spurt. And during this period of brain growth spurt, if it is exposed to hazardous influence, in this case say general anesthesia, then the development of the brain can be impaired. Now here is some positive aspect for us. The period of intense brain growth in mice, rodents, is only a few hours. In other animals, it could be few days. Whereas if we see in the human beings, it's from the late pregnancy till up to 2 years. It's a much longer phenomenon. So what 4% of sevoflurane could do for hours in a mice may not be equivalent to 4% of sevoflurane doing same for 1 or 2 hours in the human beings, because in human beings the period of growth spurt is much longer. So if you give 4% sevoflurane, say 1 or 2 hour in adult being, the amount of growth spurt that is happening in that 1 or 2 hours is not as much as compared to that in a rodent or a primate. We spoke of rodents, we spoke of monkeys. Does it happen in human beings? It does happen, but it's very difficult to pinpoint and say that general anesthesia caused this reduction in intelligence, because there are several confounding factors. There are more than 90 trials on this subject. The results have come out, but still we don't have a definitive answer because of these confounding factors. What are these confounding factors? What observations that I may gather out of a study which I conduct in a school-going children, say around 8 years to 10 years, I cannot extrapolate that to neonates. Or what study I conduct in a neonate, I cannot extrapolate it to the premature infant. So we need to have studies for all these specific age groups, because the age spectrum in human pediatric is really very wide. It's not that you give general anesthesia and the intelligence comes down. There are so many other factors which will influence these aspects. the environmental factors, the socio-economic status, the educational qualification of the parents, the environment where the child grows up, the school to which he goes. So there are so many things. So how can you just pinpoint and say he received general anesthesia and that's why his intelligence is less? It's very difficult because of this confounding factor. There are so many outcome measures that are being in study. You know, one study measures the intelligence with this score, another study measures with another score, some study memory, some study cognitive behavior, some study only the behavioral, some study psychomotor aspects. There are so many components of the neurodevelopment, and that again confuses the whole picture. Anesthetics used. What you conclude from sevoflurane may not be applicable to isoflurane. What you conclude from isoflurane might not be applicable to midazolam. What you study from midazolam may not be applicable to dexmedetomidine. So it's very difficult to generalize and say general anesthesia will cause this. The number of exposures. Probably more number of exposures of anesthesia, the influence will be different than the lesser number of anesthesia exposures. And the duration of exposure also could be a confounding factor. It's not just the general anesthesia that's happening in the perioperative period. Please do not blame only the anesthesia for everything. There could be hypoxia, there could be hypercarbia, there could be fluid mismanagement. There are so many things. The surgical stress itself is enough to affect the brain. So the brain is affected by so many things, it cannot be pinpointed only to general anesthesia. So all these confounding factors really make it difficult to come to a solid conclusion as to whether it is caused by general anesthesia alone. What do we see in the literature? I said there are about 90 plus trials. Even when we go across really very well conducted trials which have come up with some of the results which are reliable, the Australian cohort study said that the language and the cognitive skills were impacted by GA, and exposure to the volatile anesthetics for more than 35 minutes was significant. The Medicaid cohort study said that the developmental delay and attention deficit hyperactivity disorders were more with exposure to general anesthesia, and there were developmental and behavioral disorders seen with general anesthesia. Not that all trials came up with similar results. We had studies from Sweden, Taiwan, and the Danish cohort studies, which says that there's actually no influence of general anesthesia on the neurodevelopment of the babies at all. A very good design of the study would be to enroll the twins, monozygotic twins, because it takes into account several of the confounding factors, you know, like the environmental factors, the schooling, the place where they grow up. All those things are sort of matched and balanced when we study the monozygotic twins, and then you can see whether anesthesia alone influenced the outcome. What did these studies say? There was significant cognitive problems and lower educational achievements with general anesthesia. The Canadian cohort study said that the risk of early developmental vulnerability in children aged between 2 and 5 years and not in those under the age of 2 years. Very totally sort of contrasting. It says less than 2 years, no, but between 2 to 5 years, yes. This is not what we expected. We expected the lower age group to be affected more. The Singapore cohort study said the opposite. Surgery before 1 year, and they assessed the academic achievements at age 12 years. They found significant learning disability. Of course, the much quoted and what's asked in the exams, especially the full form of these studies, which always troubles us, is the MASK study, the Mayo Anesthesia Safety in Kids. It compared children who were exposed to anesthesia and surgery before 3 years with unexposed children. It found no difference in intelligence quotient. The processing speed and the motor abilities were reduced with multiple exposures to GA. So what did it say? The intelligence quotient, the intelligence was not really affected by the general anesthesia. Very reliable, huge trial. The PANDA study, Pediatric Anesthesia and Neurodevelopment Assessment Study. Again, the study design was very good because it was a prospective sibling cohort study. found no significant difference between exposed and non-exposed groups, but worse scores were seen for emotional and behavioral problems seen with GA. So these large, reliable trials actually found that the intelligence aspect was not much affected, but the behavioral aspect was definitely affected by general anesthesia. The gas trial, general anesthesia and spinal trial, which compared between the general anesthesia and the regional anesthesia alone, reported the absence of neurocognitive effect from general anesthesia compared with regional anesthesia for single and short exposures of less than 1 hour of sevoflurane in children undergoing herniorrhaphy. So that gave us some answer as to whether a regional anesthesia for procedures which can be done under regional anesthesia would be better than subjecting these children to general anesthesia. And it's one of the very well conducted trials, though it had some statistical limitations and fallacies. Meta-analysis of these 3 standard trials showed that actually the intelligence was less affected by general anesthesia, whereas the behavioral aspects were more affected by general anesthesia. The sub-analysis of these trials also showed that there was no difference between the volatile anesthetics and the intravenous anesthetics. Whether you used sevoflurane or propofol, the influence of anesthesia did not matter much with regards to the outcomes. So most of the consensus from this say that longer the duration of exposure to general anesthesia, it's likely that the neurodevelopment of the child will be affected. And with multiple exposures, this is much stronger than the duration of anesthesia. Multiple exposure is likely to affect the brain. So coming back to the question which we all have to answer to the anxious parents, is there a neurodevelopmental deficit risk with general anesthesia for pediatric age group? What do we answer? There's a pediatric surgeon standing there, staring at me, very cautious, listening attentively to my words. Anything which I say which doesn't please him, he will change his anesthetist. And at the same time, I have anxious parents, very well read, very well informed, probably even ready to sue me if they think it is required. Probably, a very important word, probably. The answer is that the neurodevelopment will not be affected for a single exposure of less than 1 hour of sevoflurane. It's uncertain for long exposure to general anesthetics and highly probable for repetitive exposures. The trials say that intelligence is very less affected and there could be behavioral abnormalities. The understanding with regards to several other drugs like sedatives that are commonly used, midazolam or say dexmedetomidine or isoflurane, propofol, so many other drugs is still not clear. This is what we can say them for sure. And the best thing to do is refer them to the reliable information on the internet rather than seeing multiple things, literature, case series and get confused. www.smarttots.org, where there is enough information even for healthcare personnel, the anesthesiologists, the current literature, and in simple words, there is also information to the parents so that there are all the frequently asked questions on these topics. The parents can read and be sure that the anesthetist has not just bluffed. It should be convincing to them that the surgery is required. It's not good to just keep postponing the surgery. At this point of time, surgery is required and there is no other alternative. General anesthesia is required. It's being done in the best interest of the child himself. Thank you.